Have you ever wondered what a doctor's visit would look like if everything, and I mean everything from booking to billing, was perfectly connected? Well, today, we're going to find out. We're going to follow a patient and a doctor through their day to see how the Novus Health platform makes that happen. We'll explore how this one system gets rid of the usual headaches, cuts down on mistakes, and lets everyone focus on what really matters, taking care of patients. So here's the game plan. We'll kick things off with a look at the platform itself. Then we'll follow the entire patient journey. After that, we'll peek behind the curtain to see how the practice operations run so smoothly. And finally, we'll dive into the super important security features that lock it all down and talk about what this all means for the future of healthcare.
So, first things first, what exactly is Novus Health? At its heart, it's a comprehensive electronic medical record, or EMR platform. But, it's designed to be way more than just a digital filing cabinet. The whole idea is to connect every single piece of the healthcare puzzle, all within one smart system.
And honestly, that's what really sets it apart. Novus Health isn't just a bunch of different tools stitched together. It's one single ecosystem. And having that single source of truth means less friction, fewer mistakes, and a way smoother experience for everybody, the patient, the front desk, and the doctor.
Okay, to see how this all works in the real world, let's meet our patient for the day, Sarah. She needs to book an appointment, and her journey starts right where you'd expect, online.
Just look how simple this is. Since Sarah's a new patient, she can request a visit without even needing a login. She just picks her appointment type, chooses Dr. Evans from a list that shows his actual, real-time availability, pops in her details, and boom, the system sends an automatic confirmation. It's just as easy for existing patients or for staff who are booking on their behalf. So, before her visit, Sarah wants to check out her patient portal, but instead of making her create another password she's bound to forget, Novus Health uses something called passkeys. And this is a total game changer. A passkey is a unique key that lives right on your device, which means there's literally no password for a hacker to steal. It's not just a better password, it's a completely different and way more secure way to log in. And it's so much easier. And get this, the setup is a one-time thing. Sarah just puts in her email, gets a secure link, and with a single click, the passkey is saved to her device. From that moment on, she can log in instantly with her phone's Face ID or her computer's fingerprint reader. Say goodbye to all those forgot password links. It's just a super smooth and super secure experience. All right, so Sarah has logged in, filled out her forms from home, and she's just arrived for her appointment. Now we get to see how the Novus platform helps out Dr. Evans and the clinical team during the actual visit. The second Sarah checks in, her patient care timeline pops up on the staff dashboard. Think of it like a progress bar for her visit. When she finishes her intake forms, a little icon turns green. When Dr. Evans starts his consultation, the next one lights up. This one simple tool keeps the whole team in sync, and nobody has to ask, hey, what's going on with the patient in room 3 ever again? Okay, now we're with Dr. Evans, and he's starting to chart Sarah's visit. One of the biggest time sucks for any clinician is documentation. So to fix that, Novus Health has this great feature called Smart Phrases. Just think of them as text shortcuts for all the common notes or instructions that doctors have to type out over and over and over again. So instead of typing out a standard follow-up plan, Dr. Evans can just type a quick shortcut, like say /follow-up. And his entire pre-written note just appears. This isn't just about saving a few seconds here and there. It's about getting back minutes for every single patient. That time adds up fast, and it lets Dr. Evans focus on Sarah, not on the keyboard. Next up, Dr. Evans decides Sarah needs some lab work done. Now, instead of scrolling through some generic, endless list of tests, the Custom Labs feature lets the practice build its own panels. You can see here the admin already created one called Complete Blood Count, which groups all the common tests together. This makes ordering labs way faster and keeps everything consistent. So, while Dr. Evans is taking care of Sarah, the platform is also working hard in the background for the practice admins. It's got some really powerful tools to keep the whole operation running like a well-oiled machine. Let's imagine the practice just hired a new nurse. The administrator can get them set up in the system in just a few clicks. They fill in the basic info, but the most important part is assigning a role. That one step is so crucial because it defines exactly what that new user can see and do inside the platform. And here's what that looks like in the real world. This table gives you a little sample of the permissions. For example, a nurse can write in the vitals section, but they can only read the doctor's final assessment. The physician, of course, has full write access to those critical areas. This kind of detailed control is key. It means everyone has exactly the access they need to do their job and nothing more. That's so important for protecting patient privacy. Beyond just managing staff, the platform gives you a crystal clear view of the practice's financial health. Right from one dashboard, an admin can see revenue in real time, track outstanding balances, and spot overdue invoices in a second. There are even forecasting tools to help them make smarter, data-driven decisions for the business. The platform also helps keep the team organized with a built-in task system. So a receptionist could assign a task to a nurse to follow up on Sarah's lab results and link it right to her patient profile. Every single notification, from new appointment requests to lab results, all flows into one central hub, which makes sure that nothing ever falls through the cracks. Okay, let's talk about something incredibly important. In healthcare, protecting patient information isn't just some nice-to-have feature. It's a fundamental requirement. It's everything. So let's look at a few of the ways Novus Health is built from the ground up to keep sensitive data safe. Dr. Evans has just finished his clinical note for Sarah's visit. Now, to make sure that note is secure for both medical and legal reasons, he uses the sign and lock feature. The moment he clicks that button and confirms his action, the note is cryptographically sealed. It becomes a permanent, unchangeable part of the patient's record. And you can see the difference right away. On the left, you've got the open, editable note. But on the right, after it's been signed and locked, all the editing functions are just gone. The only options left are to print it or, if it's absolutely necessary, to create a formal amendment. The original note itself is preserved, and it can never be altered. But security goes way beyond just the clinical notes. Any file that gets uploaded to the system, whether it's medical records from another office or a picture of an insurance card, is automatically scanned for viruses and malware. This helps protect the entire platform from potential threats.
And finally, at the core infrastructure level, the entire platform is built on Google Cloud, giving it robust protection against common web attacks. It's really this layered approach to security, from the passkeys for logging in to the sign and lock for notes, all the way to network-level protection that creates a truly secure environment for patient data. So after all that, what's the big takeaway? It's about how all these individual pieces, the scheduling, the clinical tools, the operations, the security, all locked together to create something much more powerful than any one feature could be on its own. By seamlessly connecting the patient's entire journey, the clinician's encounter, and the practice's daily operations on one secure, intelligent platform, the whole process of delivering care just becomes better. It's more efficient, it's more transparent, and it frees up clinicians from all that administrative work so they can focus on what they do best, providing excellent care. So the only real question left is, how could a system like this transform your practice?